So again, we are together, dear friends, and we'll continue our series of blood supply of the brain, and we are going to talk today about a very important artery, which is the middle cerebral artery. The middle cerebral artery is the main terminal branch of the internal carotid. As you know, the internal carotid divides into anterior and middle cerebral. The main supply goes to the middle cerebral artery, and it supplies the majority of the lateral surface of the cerebral hemisphere. So most of the lateral surface is supplied by the middle cerebral. It is considered a part of the anterior circulation, which is the internal carotid artery. The posterior circulation is the vertebropatellar system. Its perforators supply many deep brain structures. So it has very important perforators, as you will see now, and they supply very important deep brain structures. And it has, of course, cortical and deep branches, what we call the central branches. We'll start by the deep branches. Why? Because as we said, it supplies very important deep structures, and not to forget them. So the deep or central branches are branches of the middle cerebral artery. They are called the lateral lenticulostriate arteries because the medial lenticulostriate are branches of the anterior cerebral. They pierce the anterior perforated substance. If you remember the undersurface of the brain, it is present lateral to the optic chiasm. The deep structures that supply the perforators are the head and body of the caudate nucleus, a large part of the lentiform nucleus, as well as the internal and external capsule. Their blockage by thrombosis cause lacunar infarction that might lead to contralateral hemiparesis. So it is a common site of occlusion causing lacunar infarction. It is a small infarction but produces serious deficit. Also, it is a site of hemorrhage. The lateral lenticulostriate group is a site of cerebral hemorrhage because causing deep intracerebral hematoma discovered by Charcot, which was a French anatomist, and it's called Charcot's artery, part of the lateral lenticulostriate group, perforators of the middle cerebral artery. And so you will see it here. This is the chiasm. This is the internal carotid, medially dividing into the A1, or the anterior cerebral and the middle cerebral, and laterally dividing into the M1. As you will see, the middle cerebral artery is divided into M1 to M4 segments. The first segment is the M1, and the perforators arise from the M1, and they pass deep in the white matter through a perforated substance because it is perforated by the central branches of the M1 of the middle cerebral. So that's why they call it the anterior perforated substance, because we have also the posterior perforated substance, the vertebropatellar system. So it is lateral to the chiasm, branches arising from the M1, which is the horizontal or first segment of the middle cerebral, piercing the white matter, supplying deep structures like the internal capsule, the lentiform nucleus, and like the caudate nucleus. This is also a view from the left side. This is the left optic nerve, right optic nerve, chiasm, carotid, opticocarotid triangle or space, and then the carotid divides into the anterior cerebral and the middle cerebral, and the middle cerebral gives the perforators, which are the lateral lenticulostriate group arising from the M1 and supplying the passing into the anterior perforated substance lateral to the optic chiasm. This is a coronal view showing that internal carotid dividing into anterior and middle cerebral. The M1 segment, the horizontal segment, gives the lateral lenticulostriate group supplying the, as we said, the lentiform nucleus, the putamen and globus pallidus, supplying the internal capsule and supplying the caudate, head and body of the caudate. Another view, this is another view showing also the M1 giving the perforators, supplying the deep structures as we said. This is a true angiographic view, and it is showing the internal carotid artery dividing into the anterior cerebral medially and middle cerebral laterally. The middle cerebral, the first branch of the first segment, is called the M1 segment, and it gives a branch giving the perforators. Sometimes many perforators arise, sometimes one artery gives the perforators. This is called the lateral lenticulostriate group, the perforators of the middle cerebral artery. Middle cerebral artery itself is divided into 4 segments: M1, M2, M3, and M4. The M1 is called the sphenoidal or horizontal segment, as we saw it before, and it arises from the internal carotid bifurcation to the middle cerebral bifurcation, as we'll see now. The insular segment, it is inside the sylvian fissure, deep in the sylvian fissure, lying on the surface of the insula, called the insular segment, and it starts from the middle cerebral bifurcation to the circular insular sulcus. We'll see it right now. And then branches arise from the M2. They don't go immediately to the cortex, but they pass inside the sylvian fissure, hidden by the sylvian fissure, going up and down from the sylvian fissure. They are called the opercular branches. They arise from the circular sinus and of the circular insular sulcus, the insular sulcus, to the inner surface of the temporal and parietal operculum. And last but not least, the cortical branches from the opercular distal M3 to the lateral cerebral cortex. So this is roughly the divisions. The first, internal carotid here, anterior cerebral, middle cerebral, horizontal segment or the sphenoidal segment, arises from the deep part of the sylvian fissure. Sylvian fissure has a deep part and a superficial part. The M1 is present in the deep part of the sylvian fissure, and then it passes in the superficial part of the sylvian fissure, turning 90 degrees and dividing into upper and lower branches, as you will see. This is called the insular segment or M2. Then the branches of M2 give branches going up and going down, going up to the upper surface, to the parietal lobe and to the frontal lobe, and going down to the temporal lobe, and hidden in the sylvian fissure, called the opercular segment. And last, it arises and appears on the surface of the lateral cerebral hemisphere, called the cortical segment or M4. Again, summarizing: M1, horizontal segment, giving many perforators. Then it turns and bifurcates. M1 turns 90 degrees and bifurcates, forming the M2. Then the M2 give upper and lower branches, or medial and lateral branches. Then they pass to the cortex M4. So M1, M2 inside the sylvian, M3 also inside the sylvian, going from the M2 into under cover of the operculum. Then they reach the surface, forming the cortical segment or M4. This is what we see here are the cortical segments of the middle cerebral artery, and of course they are apparent, and these are the M4 segments. But if you open the sylvian fissure, you will find inside it the M2 dividing into upper and lower branch, and also branches arising from the upper and lower division under cover of the operculum called opercular segments. Let's start by the first segment, which is the M1 or horizontal segment. As we said, it is a horizontal part present in the region of the sphenoid ridge. It is the deep part of the Sylvian fissure, and at the end of the M1, the artery does two events at the same time. It turns 90 degrees to pass from horizontal backwards inside the Sylvian fissure, and it bifurcates into an upper and lower trunk. So the horizontal segment passes horizontally, carotid bifurcation to the middle cerebral bifurcation, and at the end of the M1, it turns backwards, forming the genou, and it divides into an upper and lower trunks, and as we said, it gives the lateral lenticulostriate group. So this is the M1, having the perforators here, and as we said, it turns its direction 90 degrees and it bifurcates at the same time. Curves backwards, bifurcates into an upper and lower trunk, giving the M2 segment. The M2 is called the Sylvian segment. As we said, it is present in the floor of the Sylvian fissure over the insula. And of course, it starts from the genou of the middle cerebral artery, where the artery turns 90 degrees. It passes in the superficial part of the Sylvian fissure. So the M1 was in the deep part of the sphenoidal part of the Sylvian, but the M2 is in the superficial part of the Sylvian fissure and consists of an upper and lower trunk. And it ends at the level of the circular sinus of the insula, which is a sinus surrounding the insula, separating it from the operculi. So again, if we see this view, the internal carotid artery dividing into the anterior cerebral artery and the middle cerebral artery. The middle cerebral artery starts by the M1 or horizontal segment, giving the perforators. Then it curves 90 degrees, dividing into an upper and lower trunk, what we call the MCA bifurcation. And this is the origin of the M2 segment. Another view, horizontal M1 curves 90 degrees backwards, dividing into an upper and lower segment, which is a common site for aneurysms, as we'll see now. Again, coronal view, internal carotid, anterior cerebral, middle cerebral, M1, perforators, then genou and division. Goes from horizontal backwards, 90 degrees curve, forming the upper and lower trunk, and then branches arise from the upper and lower trunk and are still inside the Sylvian fissure, called the opercular segments. Again here, anterior cerebral, the middle internal carotid, middle cerebral, and there's the M1 and the perforators, then an upper and lower segment after changing 90 degrees curve here, and then you get the upper and lower segment M2. M3, as we said, are the opercular segments, and they are arising from the circular sulcus of the insula to the Sylvian operculum, temporal or frontoparietal. We have this picture, we had this diagram before. So these are the M1 and the M2. Then the branches from the M2, still under cover of the operculum, are called opercular segments before reaching the cortex, called the cortical segment. So all this hidden branches from the M2 upper and lower trunk, hidden inside the Sylvian, are called the opercular segment. Again, M1, M2, M3, arising from These are all M3 rising from the M2 and then reaching the cortex forming the M4. This is a true cadaveric view. This is the chiasm, the right and left optic nerve, left side, left internal carotid, carotid triangle, anterior cerebral, middle cerebral, curving 90 degrees, dividing into an upper and lower trunk, the upper trunk giving branches under cover of the operculum, not reaching the cortex. These are the opercular branches. These are the opercular segment of the middle cerebral or the M3. They reach either above or they reach below, reaching from the upper trunk and going to the cortex above, from the lower trunk going to the cortex below, which is the temporal lobe. Cortex above is the frontal and the parietal lobe. These are the M3 branches. Another view, temporal, frontal. We have to open the sylvian fissure to see the M2, M1, M2, upper and lower trunks, then branches inside the operculum before reaching the cortex. Here is called the opercular segment because they are present hidden by the operculum, upper and lower. The cortical segment, after the branches of the upper and lower trunks leave the sylvian fissure, they reach the cortex and they are called the cortical branches or M4. Cortical branches of the MCA are either upper branches or lower branches. The upper branches anteriorly reach the frontal lobe, posteriorly they reach the parietal lobe, and the lower branches reaching the temporal lobe. So we have cortical branches, frontal, parietal, and temporal, as we'll see. Actually, this is not true in this diagram, but for simplicity, you don't see the middle cerebral artery, you don't see the M2 or the M3 if the sylvian fissure is closed. Here you can see the superficial middle cerebral vein, but you don't see the artery. But for sake of simplicity, we say that the artery hidden in the sylvian fissure and over the surface of the insula gives the M3, and then the M3 come out giving the branches, which are the cortical branches, and we can divide them into frontal. As you know, frontal is anterior to the central sulcus, parietal is posterior to the central sulcus, and the temporal. So the upper trunk will give a lateral orbitofrontal artery. There is a medial orbitofrontal artery coming from the anterior cerebral. So the lateral orbitofrontal artery coming from the middle cerebral, it is why called like that. It is passing into the inferior surface of the frontal lobe above the orbit, so it is called lateral orbitofrontal artery. And then you get here what we call the prefrontal branch. It is not that evident here, but if you consider this the orbitofrontal, maybe this is the orbitofrontal, and you get the prefrontal, as you will see. Then you get the pre-Rolandic or the pre-central artery and the Rolandic, which is the central artery. This is in the pre-central sulcus and this is in the central sulcus. This is the end of the frontal branches. Then you get the parietal branches, which are the anterior parietal, posterior parietal branches, and sometimes you call the continuation of the middle cerebral as the angular artery. We have parietal branch, anterior parietal, posterior parietal, and angular. And in the temporal is very easy. We have the anterior temporal, we have the middle temporal, it is not apparent here, and we have the posterior temporal. So again, middle cerebral, cortical branches, frontal branches, orbitofrontal, prefrontal, pre-Rolandic and Rolandic. Parietal, the anterior parietal, posterior parietal, and the angular, which is the continuation of the middle cerebral, the temporal branches, anterior temporal, middle temporal not present here, and posterior temporal. Again, this is a true view. You have to open the Sylvian fissure to see the M2, to see the M3, and then the cortical branches. And as we said, this is artery of the central sulcus or Rolandic, and the artery of the precentral sulcus or the pre-Rolandic, and the artery of the prefrontal area, as we said, and the lateral orbitofrontal. These are the frontal branches. Then the temporal branches, we give the post-central artery, what we call the anterior parietal artery, and then the posterior parietal artery, and it continues as the angular artery. So we have the pre-Rolandic and Rolandic frontal branches. The post-Rolandic is called the anterior parietal artery in the post-central sulcus, called anterior parietal artery. And there is a posterior branch called posterior parietal artery, and there is the continuation of the middle cerebral called the angular artery. And here also the temporal will give the anterior, the middle temporal, and the posterior temporal branches. This is more clear. The Sylvian fissure, M2 and M3, cortical branches. This is the lateral orbitofrontal on the inferior surface of the frontal lobe. Then the ascending frontal artery, as we said before. Then the precentral in the precentral sulcus or pre-Rolandic, the central in the central sulcus or Rolandic, anterior parietal in the post-central sulcus, and the posterior parietal, and it continues as the angular artery. So these branches, lateral orbital, ascending frontal, precentral, central, in the frontal lobe, anterior parietal, posterior parietal, angular, are in the parietal lobe, and here the anterior temporal artery, the middle temporal artery, and the posterior temporal artery are in the supplying the temporal lobe. Also, the temporal artery, as you will see, is giving a very important branch, which is called the temporopolar, which is supplying the pole of the temporal lobe. The frontopolar is a branch of the anterior cerebral, but the temporopolar is a branch of the middle cerebral. So again, the temporal branches of the middle cerebral, anterior, middle, posterior temporal, and the temporopolar. The branches of the frontal, as we said, lateral orbitofrontal, the prefrontal, the pre-Rolandic or precentral, the central Rolandic. Parietal branches, anterior parietal, posterior parietal, angular. Again, if you know the names, now the lateral orbitofrontal, here the prefrontal is not that apparent, but this is the pre-Rolandic, and this is the Rolandic, this is the anterior, middle, posterior temporal, this is the angular. This is to show you that the middle cerebral artery is supplying most of the lateral surface of the cerebral hemisphere, but a part of the upper part of the lateral surface supplied by the anterior cerebral artery, and the lower part of the lateral surface is supplied, the posterior part of the lateral surface is supplied by the posterior cerebral. So, main part, middle cerebral, upper lateral surface, anterior cerebral, inferior and posterior lateral surface, posterior cerebral. The distribution of the cerebral arteries, the coronal view, the most medial is the anterior cerebral, and then you get the middle cerebral and inferiorly the posterior cerebral. Surgical importance of the middle cerebral artery. It is a common site for aneurysms, and it is the site of superficial temporal middle cerebral anastomosis, done frequently in Moya-Moya disease. It used to be done in TIAs before, but it is no longer like before because the aspirin and the antiplatelets prove to be more or equally efficient. So these are the aneurysms arising from the middle cerebral artery, and we said the most common is the MCA bifurcation aneurysm. Very, very common, maybe more than 63%. Why? Because it is the site where the middle cerebral artery turns 90 degrees and bifurcates. So this is a point of weakness in the wall of the artery where it turns and it bifurcates at the same time. And you see that the aneurysm takes the direction of the artery that would have taken by the artery if it doesn't turn. So it is in the direction most of the time of the M1 segment before it curves, because the blood comes in the M1 and hits the region here before turning and bifurcating. So the turn and the bifurcation make this part of the wall weak to the common site for the aneurysms. However, some aneurysms may arise near the perforators. Some aneurysms can arise from branches from the middle cerebral or from distal branches. The distal branches are usually mycotic aneurysms, which are taken by bacteria infection in the blood, where they take the mainstream from the internal carotid to the middle cerebral, because it is the mainstream goes to the middle cerebral. So any organism in the blood passes usually in the middle cerebral and passes distally, forming infection of the wall of the artery, which produces aneurysm called the mycotic aneurysms. The MCA bifurcation aneurysm, we'll talk about it because, as we said, it is the commonest, 63%, and it can be managed by clipping or coiling. But for this artery specifically, coiling is not that good, and clipping is better than coiling. So many of the cerebral aneurysms now are managed by interventional neuroradiologists, but the middle cerebral bifurcation is still in the armamentarium of neurosurgery, and the clipping has far better result because the coiling is not that efficient in this region. This is a view of a carotid or middle cerebral bifurcation aneurysm, and as we said, it takes the direction of the middle cerebral before it curves into the M2. So it is at the junction of M1, M2, at the bifurcation of the M2. Another view, M1, M2, and we said that it takes mostly the direction of the M1 before it turns and before it bifurcates. Clipping, this is to show you an idea of MCA aneurysm, and aneurysm has a fundus and it has a neck, and the clip is applied on the neck at the junction between the artery and the aneurysm. Aneurysm is a weak point of the wall of the artery. It is a secular aneurysm, and MCA is secular, and you occlude the connection between the main artery and the aneurysm with a clip. Coiling, you introduce interventionally a catheter, a small catheter. This is the carotid, middle cerebral bifurcation. This is the upper trunk. This is the lower trunk. This is the M1, and it takes the direction of the M1 between the upper and lower trunk. This is after introducing the coil to stimulate thrombosis in the sac, aneurysmal sac. As we said, it can be done interventionally but the results are not as good as clipping, and sometimes it recanalizes and you can risk rebleeding. The second surgical importance, as we said, the superficial temporal middle cerebral anastomosis. Superficial temporal artery, as you know, is a branch of the terminal branches of the external carotid artery, divides into the superficial temporal and maxillary artery in the parotid, if you remember. We dissect the superficial temporal artery. We do a small craniotomy over the distal sylvian fissure, and we take one of the small cortical branches of the middle cerebral artery, like the angular artery, and we do an anastomosis, an end-to-side anastomosis. We cut the superficial temporal artery, we put it inside the brain through the dura, and we anastomose the superficial temporal end with the side of the middle cerebral artery. This is the view, as you will see. These are the steps of the anastomosis. This M4 branch, you do temporary clipping, and then you do an elliptical incision in part of the wall of the artery, and you take the terminal end of the superficial temporal, and you do an incision here, what you call the fish mouth, so that the ostium of the superficial temporal will fit with the end or the side opening of the middle cerebral, and then you start suturing the poles, upper and lower pole, and one side and the other side. Thank you very much. We hope you can meet very soon with another branch of the important branches of the cerebral supply of the brain. Thank you for your attention, and goodbye.